What's up, everybody? It's Josh with Rise Above, and as promised, I'm here with a comprehensive review of melatonin, as both a molecule and as a supplement. To start off with, please let me know in the comments what aspects of these reviews that you find interesting, what you'd like to hear more about with regards to a specific process, drug, or supplement. Keep in mind as well, large portions of this will be lifted directly from reviews, clinical trials, and papers, and some of it will be my general thoughts and comments on the subject. Despite the lack of FDA approval, melatonin is considered the first-line pharmacologic therapy for the treatment of insomnia by American Academy of Family Physicians. There are other indications as well surrounding sleep concerns, including shift work and jet lag. However, quote, the FDA does not regulate supplements, as supplements are generally presumed safe. This can lead to concerns about the actual concentrations of supplements, including melatonin. The best known purpose of melatonin is its role in the promotion of sleep. Melatonin is released from the pineal gland in the third ventricle and from there into circulation. Melatonin is involved in regulating the body's sleep-wake cycles through its interactions with the suprachiasmatic nucleus, which is considered to be the master clock of circadian rhythm, promoting sleep and inhibiting wake-promoting signals via interactions with its MT1 and MT2 receptors. MT1 and MT2 receptors are melatonin 1 and melatonin type 2 receptors, just so you guys are aware. For further background, from a 2015 review entitled Melatonin as a Potent and Inducible Endogenous Antioxidant, quote, the largest amounts of melatonin are not produced by the pineal gland, but rather in the gut and skin. The majority of studies related to melatonin synthesis have been performed in vertebrates, particularly in mammals such as hamster, rat, and mice. In these animals, the initial precursor of melatonin synthesis is the essential amino acid tryptophan, which I'm sure a lot of you guys have heard of. There's a big myth around there being lots of tryptophan in turkey, but it actually tends to come more from carbohydrates. So just wanted to clear that up. You might expect to actually get more tyrosine from protein like turkey, which is actually a precursor, one of the precursors of dopamine. So just in case you guys were interested. But this is the classic pathway of melatonin synthesis in mammals, as illustrated in Figure 1, which I will show to my left here. So that is the basic physiology of melatonin as a molecule and hormone. I had mentioned in my last video that there were some articles in major news publications stating that high-dose melatonin, which is taken to mean 5 milligrams or more per day for sleep assistance, is on the rise by 1.4% in the last 15 to 20 years. I personally find it interesting when a study, and mainly the subsequent news articles covering it, like this come out raising alarm bells about something that has a fairly long and good anecdotal safety record like melatonin, but for whatever reason is never studied longitudinally by the medical community in any significant way. A note, I'm naturally predisposed to question the mainstream, whether that's media or culture, but hopefully with a critical and clinical eye. So I'm going to cover the available literature here to demonstrate whether this mainstream media concern is warranted. It may be, but let's find out. A 2015 review on the safety of melatonin in humans demonstrated that, quote, in general, animal and human studies documented that short-term use of melatonin is safe, even in extreme doses. Only mild adverse effects such as dizziness, headache, nausea, and sleepiness have been reported. Long-term safety of melatonin in children and adolescents, however, requires further investigation. Due to a lack of human studies, pregnant and breastfeeding women should not take exogenous melatonin at this moment, unquote. That is of 2015, by the way. In experimental animal studies, exogenously administered melatonin has been given in doses up to 800 milligrams per kilogram without any acute toxic effects. Of course, that does not mean you should take 800 milligrams, by the way. That is actually very stupid. Remember that dosing for animal studies can be very different than in humans. In fact, there's usually some conversion required. Interestingly, a lethal dose, or an LD50, which is a dose which would be considered lethal in 50% of test subjects, could not be estimated in these studies due to the upper limit of solubility of the drug. Other randomized trials included children 2 to 18 years suffering from autism, epilepsy, and other mixed neurodevelopmental disorders, demonstrating a number of mild adverse effects such as agitation, dizziness, headache, nausea, and sleepiness, unquote. No difference between melatonin-treated individuals and those given placebo were reported for any of the outcomes. Next, a 1990 study review entitled Safety of Melatonin in Long-Term Use stated that, quote, in normal healthy adults over 18 years old, not pregnant or lactating, with no personal or family histories of psychiatric disorders, and unmedicated except for oral contraceptives and minor analgesics if necessary, the only significant short-term effect in the author's experience has been sleepiness following the oral ingestion of synthetic melatonin, 5 milligrams or less, generally oral fast release. Remember, there's instant release melatonin and prolonged release melatonin. In a 2018 study entitled Adverse Events Associated with Oral Administration of Melatonin, quote, 50 articles were assessed and 26 reported no statistic difference in adverse events between intervention and control conditions. The remaining 24 reported at least one statistically adverse event attributed to melatonin. Adverse events were generally minor, short-lived, and easily managed, with the most common reported adverse events relating to fatigue, mood, or psychomotor and neurocognitive performance. A few studies noted adverse events relating to endocrine, e.g. reproductive parameters and glucose metabolism, as well as cardiovascular, e.g. blood pressure and heart rate function, which appeared to be influenced by dosage, dose timing, and potential interactions with antihypertensive drugs. Oral melatonin supplementations in humans has a generally favorable safety profile with some exceptions, unquote. What about in higher doses of melatonin? In a 2016 review entitled Safety of Higher Doses of Melatonin in Adults, randomized, quote, controlled trials investigating higher doses, meaning 10 milligrams or more, in human adults over 30 years of age included a total of 3,861 participants. The abstract for this paper unfortunately does not list the duration of these studies. This is still a large amount of data. Studies were included in a large range of medical conditions. In 4 studies, melatonin did not cause a detectable increase in severe adverse effects, but did appear to increase the risk of adverse effects such as drowsiness, headache, and dizziness. Overall, there's been a limited adverse events reporting from high-dose melatonin studies. Based on this limited evidence, melatonin appears to have a good safety profile. Better safety reporting in future long-term trials is needed to confirm this. Briefly, I'll cover the possible effects of melatonin in the literature with regard to pregnancy. Though I was unable to find any clinical trials in humans, these review papers may provide some insight into some possible considerations for pregnancy in supplementing melatonin. In a 2018 review entitled Considerations in Treating Insomnia During Pregnancy, a literature review, the authors mentioned that, quote, while melatonin is necessary for fetal development, there may be some concerns about its supplemented use. Alterations in endogenous melatonin secretion resulting from exogenous supplementation can theoretically affect fetal circadian rhythm development. On the other hand, some animal studies demonstrate possible risks of melatonin exposure. Gonzalez-Candia et al. Found that antenatal melatonin may be associated with decreased birth weight and prolonged gestation. In a study by Singh et al., antenatal melatonin was given to rats, resulting in a mortality of 50% in pups by age 3 weeks and 95% by the age of 6 weeks. In summary, there appear to be some concerning theoretical risks of melatonin during pregnancy, so until further research is conducted on melatonin in pregnant women, the authors recommend avoiding melatonin exposure in pregnancy. And finally, a review paper entitled Melatonin in Pregnancy Effects on Brain Development and Central Nervous System Programming Disorders, which stated that, quote, alteration in maternal melatonin level has been associated with disrupting brain programming with long-term effects. The fetal brain is highly susceptible to oxygen variation and the oxidative stress that can lead to neuronal development disruption. Based on that, several approaches have been tested as a treatment in case of pregnancy disorders, and melatonin, through its neuroprotective effect, has been recently accepted against fetal brain injury, so there is some hope here for this treatment. Unfortunately, I didn't have access to the details of this last paper, and if you're interested, you can purchase it at eurekaselect.com, or you can contact the authors directly, and they may be open to sending you the paper for free, as is commonly the case. You may have to wait for them to actually send it back to you, but that's another conversation. So that's it for the safety portion of the video. It's clear from most of the literature reviewed in this section that side effects of melatonin in doses up to 10 milligrams are mostly mild and include sleepiness, headache, drowsiness, and dizziness, as well as possible interactions with antihypertensive drugs for heart disease due to possible changes in either heart rate or blood pressure. That's a wrap on the safety part. The papers also generally advise that pregnant women avoid taking supplemental melatonin, as there have not been enough studies, and the melatonin system plays a very delicate role in the development of a child's brain during pregnancy. I would think that in one-off situations, low-dose melatonin might be okay to take if your only other option would be another heavier drug for short-term use. But keep those studies in mind. Next, on to what downstream effects melatonin supplementation can have on your body. What does it do on a physiological basis? I'm fucking happy you asked. These papers will address effects of melatonin on sleep, as well as major systems of both metabolic and endocrine, meaning hormonal systems in the body. So for downstream effects, of course, the primary use of melatonin is as a sleep aid. So what effect does it actually have on sleep quality, sleep duration, and sleep latency, or time to falling asleep? Firstly, in a systematic review and meta-analysis published this year entitled Effects of Melatonin Supplementation on Sleep Quality, quote, 23 randomized clinical trials met inclusion criteria. Results indicated that melatonin had significant effect on the sleep quality as assessed by the Pittsburgh Sleep Quality Index, or PSQI. Treatment with melatonin was found to have positive effects on sleep quality as assessed by the PSQI in adults with respiratory diseases, metabolic disorders, primary sleep disorders, not with mental disorders, neurodegenerative diseases, and other diseases. Just FYI, the Pittsburgh Sleep Quality Index, PSQI, is a self-reported questionnaire that assesses sleep quality over a 1-month time interval. Got that note from Wikipedia, of course. In a 2019 systematic review and meta-analysis entitled Exogenous Melatonin as a Treatment for Secondary Sleep Disorders, quote, 7 studies of 205 patients were included, demonstrating that exogenous melatonin lowers sleep onset latency, meaning time until you fall asleep, and increases total sleep time, whereas it has little if any effect on sleep efficiency. The dosages ranged from 3 to 6 milligrams, with 5 milligrams being the most frequently used. Average duration of study was from 3 to 9 days. Sleep latency was reduced to about 2.5 minutes. Again, that's time before falling asleep. Whereas total sleep time was increased a whopping 30 minutes. There was no effect on sleep efficiency, however, which is the percentage of time spent actually sleeping while in bed. So that's interesting. Next, we have a 2013 review and meta-analysis entitled Melatonin for the Treatment of Primary Sleep Disorders. Quote, 19 studies involving 1,683 subjects were included in the meta-analysis. Melatonin demonstrated significant efficacy, meaning effectiveness in reducing sleep latency, with a weighted mean difference of about 7 minutes, and increased total sleep time 8.25 minutes. Trials with longer duration and using higher doses of melatonin demonstrated greater effects on sleep latency and increasing total sleep time. Overall, sleep quality was significantly improved in subjects taking melatonin compared to placebo. No significant effects of trial duration and melatonin dose were observed on sleep quality, however, unquote. And finally, with regard to controlled release melatonin, because you guys know I just mentioned there's an instant release and a long or prolonged release melatonin. There was a 2010 randomized controlled trial entitled Nightly Treatment of Primary Insomnia with Prolonged Release Melatonin for 6 months. So for a melatonin study, this is actually on the longer side. Quote, 709 adult outpatients aged 18 to 80 years with primary insomnia were treated with placebo for 2 weeks, and then randomized to double-blind 3 weeks with prolonged release melatonin or placebo nightly. Prolonged release melatonin significantly reduced sleep latency compared to the placebo in elderly patients regardless of melatonin levels by an average of 19.1 minutes versus 1.7 minutes. So that's very significant. The effects on sleep latency and additional sleep and daytime parameters were improved with prolonged release melatonin and were maintained or enhanced over the 6-month period with no signs of tolerance. Most adverse events were mild in severity with no clinically relevant differences between PRM, prolonged release melatonin, and placebo for any safety outcome. The results demonstrate short and long-term efficacy and safety of PRM in elderly insomnia patients. Low melatonin production, regardless of age, is not useful in predicting responses to melatonin therapy in insomnia. Those reviews, there's a lot of talking. Those reviews and studies were the most easily applicable to a broad swath of the population. There were also studies of melatonin used for Alzheimer's and Parkinson's disease, which I may cover in the future. Now on to the effects of melatonin on other bodily systems. A systematic review published last year in 2021 entitled Effects of Daily Administration of Melatonin Before Bedtime on Fasting Insulin, Glucose, and Insulin Sensitivity in Healthy Adults and Patients with Metabolic Diseases. My God, that's a long name. Quote, 11 of 100 randomized clinical trials were selected and eligible for review, in which daily oral intake of melatonin was in the range of 0.3 and 10 milligrams. Was assessed over 2+ weeks before bedtime, including healthy adults or patients with glucose metabolic diseases, which would include diabetes. The results were that long-term treatment with melatonin did not significantly change fasting glucose compared with placebo, but it reduced fasting insulin levels slightly and trended towards reduced insulin resistance, which is fantastic. Hemoglobin A1C levels were largely unaffected by melatonin treatment compared with placebo. For those that don't yet know, insulin resistance is when you have very high levels of insulin in the bloodstream, which is one of the major clinical markers of diabetes, indicating how much work the body is doing to attempt to store glucose in the body, in muscle tissue, fat tissue, and around the liver. Hemoglobin A1C is a marker of red blood cell storage of glucose, which is a marker of long-term storage of that glucose or sugar. A1C is a compound formed when that glucose binds to red blood cells and is the primary diabetes marker indicating how saturated your cells are with glucose over the long term. It's generally the marker that is used by clinicians to actually diagnose diabetes, so it's very important. Melatonin may have marginally beneficial effects on glucose metabolism, resulting in a small reduction in insulin levels. Remember that type 1 and 2 diabetes are caused by different mechanisms. Type 1, or insulin-dependent diabetes, is an inability to produce insulin normally due to autoimmune reaction against something called pancreatic beta cells. Type 2 is hyperproduction of insulin due to inability to process glucose correctly, leading to something called insulin resistance. By the way, an interesting book on type 2 diabetes is called The Diabetes Code. This was recommended to me to read by a friend. I haven't read it yet, but it details how type 2 diabetes might be reversed with proper dieting and intermittent fasting. Those of you with type 2 diabetes or someone you know who has it might want to check out that book. Regarding this specific paper, I'm unsure if it's that review differentiated between types 1 and 2 diabetes, so this is something to keep in mind and possibly investigate. Unfortunately, the abstract did not include that information. I may investigate melatonin's differential effects in type 1 and type 2 diabetes in a future video. Next, a review of the effects of melatonin supplementation on inflammation in the body. A 2020 systematic review and meta-analysis entitled Melatonin Supplementation and Pro-Inflammatory Mediators compiled, quote, 13 studies with a total sample size of 749 participants were included in the meta-analysis. Melatonin supplementation significantly decreased tumor necrosis factor alpha and interleukin-6 levels by 2.24 picograms per milliliter and 30.25 picograms per milliliter, respectively. The effect on melatonin of C-reactive protein levels was marginal, with a weighted mean difference of 0.45 milligrams per liter, which is significant but marginal, somewhat small. The results of the present meta-analysis support that melatonin supplementation could be effective on ameliorating of inflammatory mediators. For reference of the audience on these, quote, tumor necrosis factor alpha is known to trigger a series of various inflammatory molecules and was initially recognized as a factor that causes necrosis or degradation of tumors. Newly approved tumor necrosis factor alpha inhibitors have shown noticeable potency in a variety of autoimmune disorders, as well, including rheumatoid arthritis. Interleukin-6 is an inflammatory cytokine or cell type which stimulates, quote, inflammatory and autoimmune processes in many diseases such as sclerosis, diabetes, atherosclerosis, depression, Alzheimer's disease, lupus, multiple myeloma, and prostate cancer, as well as a few others like rheumatoid arthritis that I mentioned. Advanced and metastatic cancer patients have higher levels of interleukin-6 in their blood as well. One example of this is pancreatic cancer, which, with a noted elevation of interleukin-6, is present in patients correlating with poor survival rates. There is some early evidence that interleukin-6 can be used as an inflammatory marker for severe COVID-19 infection with poor prognosis in the context of the wider coronavirus pandemic, unquote. Whew, that's a lot of talking. What about hormones and sexual health? That's very important as well. Let's examine some of the potential effects of melatonin supplementation here. The first is a study of the effects of melatonin on pituitary hormones, namely cortisol, growth hormone, prolactin, and others. A study from 1999 entitled "The Effect of Melatonin Administration on Pituitary Hormone Secretion in Man" was a, quote, double-blind randomized crossover study. 8 healthy male volunteers with a mean age of 21 years were studied on 4 occasions during the course of the day in doses of 0.05, 0.5, or 5 milligrams or placebo. They refrained from taking heavy exercise, alcohol, and from smoking 24 hours prior to the study. Melatonin produced dose-dependent changes in circulating concentrations of oxytocin and vasopressin, the 0.5 dose being stimulatory while 5 milligrams was inhibitory. Those 2 doses stimulates growth hormone release, no effect on prolactin or cortisol release, and dose-dependently stimulates or inhibits oxytocin and vasopressin, unquote. Low oxytocin levels have been linked to symptoms of depression, including postpartum depression, according to Health Harvard. Oxytocin can actually be boosted with exercise, listening to music, and also from physical touch. A 1990 study entitled "Effects of Long-Term Low-Dose Time-Specified Melatonin Administration" followed, quote, 6 healthy adult male volunteers undergoing blood drawings at 4-hour intervals over 24 hours. After a 2-month course of treatment with melatonin, 2 milligrams by mouth daily at 6 p.m. After treatment, they recorded a marked elevation of melatonin levels with a significant phase advance of circadian rhythm. Phase advance, this means the test subjects were seemed to wake up earlier and retire earlier as well, which is what phase advance is. There were no changes to thyroid hormones, cardiac rhythms, prolactin levels. Cortisol and testosterone both rose earlier in the day than during pre-treatment, indicating a possible anticipation of the new circadian rhythm. None of the volunteers complained of any adverse reaction apart from transient increase of evening drowsiness, unquote. Most interesting here is the phase shift. I personally tend to rise fairly early and go to bed fairly early, and have found that melatonin, at the very least, has not hurt me with that. It may have actually assisted me in making that phase advance, meaning earlier wake up and bedtimes, more comfortable. Lastly, a study on the effects of melatonin on semen quality for those interested in having children. A trial entitled "Melatonin Administration Alters Semen Quality in Healthy Men" was a 6-month double-blind crossover study with a daily treatment dose of 3 milligrams of melatonin or placebo. In 6 men, there was no change in semen quality. In 2 men, during the melatonin treatment period, sperm concentration decreased and motility declined to 32 and 30%, respectively. 6 months after the cessation of melatonin, sperm concentration and motility were normal in one of those men, but one of the men remained abnormal. Keep in mind, unquote, keep in mind that this is a tiny sample size, but it's something to keep in mind if you're looking to have kids and potentially having some difficulty. In conclusion, it seems to me from the available literature, melatonin is safe and healthy in most subjects, but also on a surface level, possibly safe in those with certain neurological disturbances and metabolic disorders. It has a positive effect by way of small reductions in insulin level, promoting insulin sensitivity, which would be useful in type 2 diabetes. Side effects are not common, but can include drowsiness, headache, dizziness, agitation, lowered heart rate, lowered blood pressure, and there's a possibility of interaction with antihypertensive medications. So there are some small side effects or possible adverse events, but nothing like your average pharmaceutical commercial. It's relatively low risk, it seems. There's also a small indication of partial reduction in semen quality and sperm motility, which generally reverses after discontinuation. Lastly, it is not recommended in the literature that pregnant women take melatonin at this time. That's it for this video. If you made it all the way to the end, congratulations. In the next video, I will be covering the biohacking aspects of melatonin in aging, neuroprotection, and as a possible cancer prevention supplement, all based on the available medical literature. If you guys enjoyed the video or found it interesting, please subscribe, like the video, and leave a comment. If you found it long-winded, or if you have any critiques or things that you might like me to change about the presentation, I'd also appreciate that feedback as well. Thanks, and I will see you on the next one. Later, guys.